5 warning signs 99% of seniors show before they die and why you must not ignore them. If you're over 60 and you've been ignoring these subtle changes in your body, you could be missing critical warning signs that something serious is happening. Last month, a 67-year-old woman named Ruth dismissed her minor symptoms as just getting older. 3 weeks later, she was rushed to the emergency room. The tragedy? Every single warning sign was there, but she didn't know what to look for. Today, I'm going to show you the 5 warning signs that 99% of seniors experience before a life-threatening event, signs that doctors often miss and families overlook. Don't let this happen to you or someone you love. Welcome back to Life Advice for Older People. I'm here because too many seniors and their families are missing the subtle but crucial signals their bodies are sending. Here's what's shocking. Medical research shows that in 9 out of 10 cases, these warning signs appear weeks or even months before a serious health crisis, but they're dismissed as normal aging. The truth is, while getting older is inevitable, sudden decline isn't. Today, you're going to learn the 5 specific warning signs that your body uses to tell you something serious is happening. I'll show you exactly what to look for, when to be concerned, and most importantly, what actions you can take right now. By the end of this video, you'll have the knowledge that could literally save your life or the life of someone you care about. The 5th warning sign I'll share is the one that surprises everyone. Even healthcare professionals often miss it. Have you or someone you know experienced any concerning changes lately? Share your story in the comments below. Your experience could help another viewer recognize these crucial signs. Warning sign. #1. The first warning sign is sudden changes in your sleep patterns and energy levels. Now, I'm not talking about the occasional restless night or feeling tired after a busy day. I'm talking about dramatic shifts that seem to come out of nowhere. Here's what to watch for. You've always been a good sleeper, but suddenly you're waking up at 3 a.m. and can't get back to sleep. Or maybe you're sleeping 10, 12 hours but still feel exhausted. Perhaps you're finding yourself nodding off during activities you used to enjoy. Or you have zero energy for things that never used to tire you. Let me tell you about 72-year-old David. For years, he slept like a baby from 10 p.m. to 6 a.m. Then suddenly, he started waking up multiple times during the night, drenched in sweat. During the day, he could barely keep his eyes open. His wife kept saying, "Honey, you're just getting older." But David's body was actually screaming that his heart was struggling. Those night sweats? His cardiovascular system was working overtime, the daytime fatigue. His heart couldn't pump efficiently anymore. Here's the science. When your body is fighting a serious condition, whether it's heart disease, diabetes, or even certain cancers, it redirects energy to healing, leaving you feeling drained. Sleep disruption happens because your body's stress response is activated, flooding your system with cortisol and adrenaline. What should you do? Start keeping a simple sleep diary. Note when you go to bed how many times you wake up, and rate your energy level each day from 1 to 10. If you see a pattern of poor sleep combined with persistent fatigue lasting more than 2 weeks, don't wait. This isn't about getting older, this is your body's alarm system. Pay special attention to these specific changes: waking up gasping for air, new snoring patterns, legs that feel restless at night, or sudden changes in your sleep schedule. These can indicate sleep apnea, heart problems, or neurological issues that need immediate attention. The key is recognizing that significant sleep changes aren't normal, even as we age. Healthy seniors might sleep a bit less deeply or wake up once during the night, but dramatic shifts in sleep patterns are your body's way of telling you something is wrong. Have you noticed any sudden changes in your sleep or energy? Let me know in the comments. And stick around, because the second warning sign is one that most people completely ignore, even though it's often the first sign of something serious. Warning sign #2. Warning sign number 2 is unexplained weight loss or significant appetite changes. This is the sign that families often celebrate at first, not realizing it could be signaling something deadly. Here's what I mean. You're not dieting, you're not exercising more, but you've lost 10 pounds in the last month. Or maybe food just doesn't taste good anymore. Things you used to love now seem bland or even disgusting. Perhaps you're eating the same portions, but the scale keeps dropping, or you feel full after just a few bites. Let me share what happened to 69-year-old Alice. She had always struggled with her weight, so when she started dropping pounds without trying, her family was thrilled. "You look great, Mum," they said. But Alice knew something was wrong. Food tasted like cardboard, and she had to force herself to eat. Within 6 weeks, she'd lost 25 pounds. It turns out she had pancreatic cancer, and her body was trying to tell her months before any other symptoms appeared. Here's the critical threshold. Losing more than 5% of your body weight in 6 months without trying is a red flag. For a 150-pound person, that's just 7.5 pounds. It might not seem like much, but it's your body's way of saying something is seriously wrong. The science behind this is crucial to understand. When your body is fighting cancer, infections, or other serious conditions, it burns through calories at an accelerated rate. Your metabolism shifts into overdrive and your appetite-regulating hormones get disrupted. Changes in taste and smell often happen because illness affects the nerve pathways that control these senses. What should you monitor? Weigh yourself weekly at the same time of day, wearing similar clothes. Keep track of your appetite. Are you eating smaller portions? Do foods taste different? Are you avoiding meals because nothing seems appealing? These changes can indicate thyroid problems, diabetes, liver disease, or various cancers. Pay attention to these specific warning signs: clothes becoming loose rapidly, feeling full after eating very little, new food aversions, metallic taste in your mouth, or nausea when you smell food. These symptoms, combined with weight loss, need immediate medical attention. But here's what's tricky. Age-related muscle loss can mask this warning sign. You might maintain the same weight but actually be losing muscle while gaining fat. Look for signs like decreased strength, difficulty climbing stairs, or feeling unsteady on your feet. The mistake most people make is assuming weight loss is always good news. In seniors, unexplained weight loss is often the first sign of a serious underlying condition. Don't wait for other symptoms to appear. They might come too late. Have you experienced any unexplained weight changes or appetite issues? Share your experience below. Your story could help someone else recognize this crucial warning sign. Coming up next is the warning sign that affects your mind, and it's not what you think. Warning sign. #3. Warning sign number 3 is cognitive changes and memory issues that go beyond normal aging. This is where families often miss the mark, dismissing serious symptoms as just getting older. Let me be clear about what normal aging looks like versus what should concern you. It's normal to occasionally forget where you put your keys or struggle to remember someone's name. It's not normal to forget how to get to places you've been going for years, to repeat the same story multiple times in one conversation, or to have difficulty following familiar recipes. Here's a real example. 71-year-old Henry was always sharp as a tack. Then his wife noticed he was asking the same questions repeatedly, getting confused about what day it was and struggling with tasks like balancing the checkbook, something he'd done for decades. His family brushed it off. Dad's just having senior moments. But Henry's brain was actually showing early signs of dementia, and catching it early could have slowed the progression significantly. The key is recognizing the pattern and severity. Normal aging might mean occasionally forgetting a word or taking longer to process information. Concerning signs include getting lost in familiar places, difficulty following conversations, problems with complex tasks you used to handle easily, confusion about time and place, or personality changes, like becoming suspicious or withdrawn. Here's a simple test you can do at home. Try to remember a short list of words after a 5-minute delay. Can you recall what you had for breakfast 2 days ago? Can you follow a multi-step recipe without constantly checking the instructions? If these tasks are becoming significantly harder, it's time to pay attention. But here's what's crucial. Cognitive changes aren't always about dementia. Depression, medication side effects, vitamin deficiencies, thyroid problems, and even urinary tract infections can cause memory issues and confusion in seniors. The good news? Many of these causes are treatable. Watch for these specific warning signs: difficulty finding words, problems with judgment or decision-making, changes in mood or personality, withdrawal from social activities, or difficulty completing familiar tasks. These changes happening together over weeks or months need professional evaluation. The science shows that early intervention can make a huge difference, whether it's medication adjustments, treating underlying conditions, or starting cognitive therapies. Catching these changes early gives you the best chance of maintaining your independence and quality of life. Don't let pride or fear stop you from seeking help. I've seen too many families wait until the changes become severe because they were afraid of what they might find. Early detection means more treatment options and better outcomes. There's also a difference between occasional forgetfulness and the kind of cognitive changes that signal something serious. If you're worried about your memory, start keeping a simple journal. Note when you have trouble remembering things, what kind of tasks become difficult, and any changes in your thinking patterns. Are you noticing any changes in your thinking or memory? Don't be afraid to share in the comments. Recognizing these signs early can make all the difference. Up next is warning sign number 4, and it's one that silently destroys health faster than almost anything else. Warning sign #4. Warning sign number 4 is social withdrawal and personality changes. This is the silent killer that families often don't recognize until it's too late, because it happens gradually and can seem like a natural part of aging. Here's what I want you to watch for. Someone who used to be social suddenly stops calling friends, declines invitations they would have accepted before, or seems to have lost interest in hobbies and activities they once loved. Maybe they're becoming more irritable, anxious, or negative than usual, or perhaps they're sleeping more during the day and avoiding family gatherings. Let me tell you about 66-year-old Carol. She was the life of every party, always organizing family dinners and volunteering at church. Then slowly she started declining invitations. "I'm just tired," she'd say. She stopped hosting her weekly bridge games and quit volunteering. Her family thought she was just slowing down with age. But Carol was actually experiencing early signs of depression and heart disease. The social withdrawal was her body's way of conserving energy because her heart couldn't handle the physical and emotional demands of social interaction. Here's the crucial connection. Social isolation doesn't just affect your mood, it literally affects your physical health. Research shows that loneliness and social isolation increase your risk of heart disease by 29%, stroke by 32%, and dementia by 50%. It's as dangerous as smoking 15 cigarettes a day. The science behind this is fascinating. When you withdraw socially, your body goes into a chronic stress state. Your immune system weakens, inflammation increases, and your body starts breaking down faster. It's like your body is preparing for danger by shutting down non-essential systems. Watch for these specific personality changes: increased irritability over small things, anxiety about situations that never bothered them before, loss of interest in appearance or personal hygiene, unusual suspicion or paranoia, or becoming more rigid about routines. These changes often signal depression, early dementia, or underlying medical conditions. But here's what's tricky. Medical problems can cause personality changes, and personality changes can cause medical problems. It's a vicious cycle. Someone with untreated diabetes might become irritable and withdrawn, which then leads to poor self-care, which makes the diabetes worse. What should you do? Pay attention to changes in social patterns over 4-6 weeks. Are they avoiding phone calls, declining activities they used to enjoy, seeming more negative or anxious than usual? These aren't just personality quirks, they're warning signs. The key is understanding that healthy aging doesn't mean becoming isolated or dramatically changing your personality. Yes, you might slow down a bit or prefer quieter activities, but complete withdrawal from social connections is a red flag. If you're experiencing this yourself, here's what you can do. Start small. Make one phone call to an old friend. Accept one invitation you might normally decline. Join one activity, even if it's just a short walk with a neighbor. The goal isn't to become a social butterfly overnight, but to maintain those crucial human connections. For family members watching a loved one, don't accept "I'm fine" as an answer if you're seeing these changes. Gentle persistence is key. Offer specific help. "I'm going to the store, want to come with me?" rather than "let me know if you need anything." The bottom line is that social withdrawal accelerates physical and mental decline. It's not just about being lonely. It's about your body losing its will to fight and thrive. Have you noticed any changes in your social patterns or those of someone you love? Share your observations below. Recognizing this pattern early can literally save lives. Coming up is the fifth and final warning sign, and it's the one that catches everyone by surprise. Warning sign number 5 is frequent falls, balance issues, or unexplained physical symptoms. This is the warning sign that surprises everyone because people think falls are just accidents, but they're actually your body's way of telling you something critical is wrong. Here's what most people don't realize. A fall isn't just a fall when you're over 60. It's often the first sign of medication interactions, inner ear problems, heart issues, neurological changes, or even serious infections. Every year, 1 in 4 seniors falls, but here's the shocking part. Most of these falls are preventable warning signs that something else is going wrong. Let me share what happened to 73-year-old Stanley. He was always steady on his feet, then suddenly he stumbled getting out of bed one morning. A week later, he lost his balance reaching for something in the kitchen. His family said, "Dad, you need to be more careful." But Stanley's body was actually warning him that his blood pressure medication was causing dangerous drops when he stood up, and his inner ear was being affected by an undiagnosed infection. Here's what you need to watch for. Unexplained dizziness, especially when standing up, feeling unsteady on your feet for no apparent reason, stumbling or catching yourself more often, muscle weakness in your legs, or persistent aches and pains that seem to come from nowhere. The science is critical to understand. Balance problems can indicate inner ear infections, low blood pressure, diabetes complications, heart rhythm problems, or even early signs of stroke. Unexplained muscle weakness might signal vitamin deficiencies, thyroid problems, or neurological conditions. These aren't just signs of getting older, they're your body's emergency signals. But here's the most important part, the cascade effect. When seniors fall, it often triggers a downward spiral. First comes the physical injury, then the fear of falling again, which leads to reduced activity, which causes muscle weakness, which increases fall risk even more. It's a cycle that can quickly steal your independence. Watch for these specific warning signs. Difficulty getting up from chairs, needing to hold on to walls or furniture when walking, feeling dizzy when you change positions, unexplained bruises that might indicate unreported falls, or avoiding activities because you're worried about falling. Here's a simple balance test you can do safely at home. Stand near a wall or sturdy chair for support. Try to stand on one foot for 30 seconds. If you can't maintain your balance for at least 5 seconds, or if you feel dizzy or unsteady, this needs attention. Pay attention to environmental factors too. Are you tripping over things you used to navigate easily? Having trouble with stairs you've used for years? These changes in your relationship with your physical environment often signal that something is affecting your balance, vision, or coordination. The key is recognizing that balance issues and unexplained physical symptoms aren't inevitable parts of aging. They're warning signs that your body needs help. Maybe it's adjusting medications, treating an infection, addressing vision problems, or managing an underlying condition. Don't let fear of falling keep you from staying active, but don't ignore the warning signs either. The goal is to address the underlying causes before they lead to a serious fall or injury. What should you do? Start with a medication review. Many falls are caused by drug interactions or side effects. Make sure your vision is current. Remove tripping hazards from your home. But most importantly, if you're experiencing new balance issues or unexplained physical symptoms, don't wait. These could be early warning signs of treatable conditions. Have you experienced any unexplained balance issues or physical symptoms? Share your experience in the comments. Your story could help someone else recognize these crucial warning signs before it's too late. Here's the amazing truth. Recognizing these warning signs early can completely transform your health outcome. Take 68-year-old Raymond, who noticed 3 of these warning signs: sleep disruption, unexplained weight loss, and balance issues. Instead of dismissing them as getting older, he took action immediately. His doctor discovered early-stage diabetes and a medication interaction that was causing his symptoms. With simple adjustments to his medication and lifestyle, Raymond not only resolved all his symptoms, but actually felt better than he had in years. Today, 2 years later, he's healthier, more energetic, and living independently. This is the power of listening to your body's warning system. These signs aren't predictions of doom, they're opportunities for intervention. Every single one of these warning signs is your body's way of saying, "Help me now while I can still recover." The difference between those who thrive in their later years and those who struggle isn't luck, it's recognition and action. When you know what to look for and take these signs seriously, you're not just preventing crisis, you're reclaiming your health and your future. Remember, getting older doesn't mean accepting decline. It means becoming wiser about listening to your body and taking action when it needs help. These warning signs are gifts. They're your body's way of giving you time to make changes before it's too late. If this video opened your eyes to warning signs you might have missed, please hit that like button and share it with someone who needs to hear this information. Your share could literally save a life. In the comments below, tell me, have you experienced any of these warning signs? What symptoms have you been dismissing as just aging? Your story could help another viewer recognize these crucial signs. Don't forget to subscribe and ring the notification bell. Remember, knowledge is power, but only when you act on it. Take these warning signs seriously and don't let anyone tell you it's just getting older. Your body is smarter than that, and now you are too.